Hello, it's Lexi with Mike Rhees here again. And today we're going to dive into a topic that may be helpful for you when you're speaking to your clients and they're already using their own supplements, or just for yourself to know what's important when you're looking for good quality supplements and nutraceuticals. So, Mike, so glad to have you again here as always.
Be here.
Um, this has been a topic that I've struggled with, right? Every client comes in and they already tell me they're taking 100 different supplements. And one of my first questions is always, well, where are you getting them from? Um, but they seem sometimes a little taken aback that I would question where they're buying them from. And so I think this is really important for us. How do we address this with clients and what should we be looking for? Because obviously the supplements that we may give clients may be expensive, more expensive than something they're going to find at Walgreens at the, buy two, get 20 free shelf. And why it's important to invest a little bit more in your health when you are purchasing supplements. So welcome. Sorry, that was a long intro. um, so we touched on this topic just a little bit in the last two videos about neurotransmitters, the one for the adults and briefly again, the one for the kids. So let's have at it. I mean, what should someone be looking for in a good quality supplement or nutraceutical?
Number one, considering all the brands out there, which there are many globally, not just in the US alone, but all over the place. Number one is to look for a professional line, a line that that licensed practitioners are able to order wholesale from. And the reason why, although there are other brands that aren't in that category that are super high quality, there's some good ones out there. If you can look towards practitioner lines or healthcare professional lines, that will ensure you'll kind of narrow the focus a little bit in terms of quality control, quality assurance. They've had more auditing occur. They've had the FDA come in by surprise. Nobody was expecting it. I've witnessed this at Systemic Formulas. I had been at Systemic Formulas for a year, and everything was just awesome this one morning, and all of a sudden the FDA comes walking in. They pulled in. There was no warning beforehand. They came in and they did an audit on the entire facility. They did an audit on the laboratory. They did an audit on marketing materials and everything. So, and I realized that before the FDA came, Systemic Formulas was doing everything they could to, meet strict standards already.
Right.
But having that audit, that doesn't just happen everywhere. You're not going to see the FDA just, going into every brand that's out there that you see at Walmart or on Amazon. All the sports nutrition and all the bodybuilding supplements and the pre-workouts and the nitric oxide boosters and bars and shakes and all that stuff. They don't all get the same level of auditing, the same strict standards that a professional line will have.
I thought there was very little regulation because really the FDA does not regulate supplements. But when it's a professional line, you are, as a manufacturer, inviting them in for more, like you said, assurance, quality, auditing type of things to ensure that your product is meeting very strict standards. One thing I've noticed, and I'm sure a lot of people have heard that, like there's different supplements that may not be the best quality, and they go test these supplements and they contain little, if any, of the actual ingredient that they say they have in there. But on the other hand, it's also the fillers that are in there that can be toxic to your clients because we don't know what's in those fillers always. It can create distress and more issues. So what have you, you know, what are potential side effects from taking very poor quality supplements, or what can someone maybe experience if they do?
It can vary from potential digestive issues to toxicity. Neurotoxicity could be one of the supplement or one of the symptoms that, that's one of the, can you hear that in the background?
Nope.
Oh, you can't. Okay.
Mm-mm.
Sorry, I'll have to edit that part. Okay, here we go. The fillers, depending upon what they are, is it sugar alcohols to make the product taste better? If it is a meal replacement shake and they're promoting the fact that it's all 100% plant-based and it's easy to digest protein, while that might be true, and it has a good amount of fiber, it has a good, cross section, or it's full of all, vitamins A, E, C, all the B vitamins. It has magnesium in there. The sources are really good of the vegan proteins, but it has a high content of like erythritol or xylitol is still a big one. These sugar alcohols, although they're not super bad, like let's say aspartame in Diet Coke or Yoplait yogurt, these types of sugar alcohols can cause digestive distress. And so in bars, in powders, it's not uncommon that you're going to run into these ingredients. They really help with the flavor. Another one is sucralose, and that helps elevate flavor. I guess the downside of having the product be so clean, free from sucralose, free from these sugar alcohols, then what are you left with to sweeten it up? Because practitioner lines, the licensed practitioners, they do not want to see a lot of sugar in there. They don't want to see a lot of carbohydrates. They don't want the inflammatory cause of the sugars. So then what do you do? How do you flavor this product? Well, I mean, there are those exceptions as long as it's within a certain amount, like molasses, maple sugar, pure cane sugar, organic pure cane sugar, but still you've got to keep it limited.
Right.
And so those are some fillers, I would say,
that are okay.
It helps a bar taste better.
Okay.
It can cause digestive gas. It can cause bloat. It can cause different havoc that people deal with. And I'm not going to mention any names because some of these bars are ones I used to eat all the time, and I liked them.
Right.
They had the kind of protein I wanted and whatever.
It's so hard. I mean, just today before we got on the call, I was looking for a full, good quality amino acid supplement because we've discussed in the past, my kids are eating way too much protein. I'm worried about the acidity. So if I can give them a good full amino acid profile, but then I'm like, all of them have some sort of sugar, even the cleanest ones that I've seen. So I sit there and I go, wow, like, what do I do? And so I haven't done anything. So last time we had briefly talked before we got on the call about different certifications or labels that we want to look for. It may not actually be on the actual supplement, but on the manufacturer's website, they should have all of, different certifications if they are certified. So what are those? What do they mean for us?
Yeah, absolutely. The number one I would look for is CGMP. C stands for current, good manufacturing practices. What that means is that the manufacturing facility has met all of the requirements. It's a benchmark standard.
Okay.
If you were to go into their warehouse where their shippers are putting everything together, putting all the bottles in boxes and shipping out the orders, that area looks pristine. Everything's clean. The bottling room or the bottling rooms, all the standards are met there in terms of cleanliness, in terms of cleaning afterwards, the way the machines are run, the way the machines are taken care of. the way people are dressed in hair nets and beard nets, and the list goes on and on. Sometimes it's stuff over their shoes when they're in the encapsulator room. If most companies, have their encapsulators or more than one encapsulator, so they have multiple rooms and they have the operator in there, and he's got to be in the coat. He's got to have all of his street clothes covered, and there's just no contaminants in there, and they're running the machine after that batch is done. When Systemic Formulas runs the product bind of all things, and it's just like completely just dark gray when they're done, because of all that charcoal, they've got to clean. And however long it takes, they have to clean, and they have to meet those requirements before they start encapsulating calm or whatever is next on the docket, right?
Right.
Encapsulators, there's blenders. So when all the raw ingredients come into a manufacturer, like Systemic Formulas or like a Designs for Health or Standard Process, there's a big old blender, and it's going to take all those ingredients for that product in the right amounts, and it's going to blend them all up into a fine powder. That blender, imagine how many times that has to be cleaned. You're not going to leave a bunch of powder stuck over here in this corner or whatever. I mean, there's this day-to-day process. It is so strict and it's so regimented in terms of the quality of how to run a blender. You have to have trained individuals to do that. The packets machine, that the true cellular detox phases that you might be familiar with, prep phase, body phase, brain phase, etc. There is a strict process in terms of how the capsules get enclosed into a sachet packet and all of that. The liquids room, and so on. And then the lab, which, the third-party lab, I mean, the amount of strict requirements they have to have for GLPs, good lab practices. When you know that all of those things are being met, then you have that rest assurance. And you can usually find out from a company, you can usually ask customer service, or you can get on the online chat, or you can get a hold of the right person that helps with their product questions to verify if there's any nuts. For people with nut allergies, you want to stay away from that. Is there any gluten? Are there any GMOs? Is there, so are the products gluten-free? Are there any genetic modified organisms? Are there, let's see, I mean, there's other things too. Glyphosate is another thing. While not all companies have paid for those stamps on their labels, they don't all have that printed out on their labels yet. They can usually go in and they can confirm with you that, there's no gluten, there's no nuts, there's no this or that.
So even if, because I know a lot of these things like the organic label or the gluten-free or the soy-free, there's always cost to be able to put them on the labels. And so some smaller companies that still have excellent quality may not have the funds to pay for some of that stuff. So am I wrong in that I always look through their FAQs and their best practices and what they're doing to see if they meet those standards, even if they're not paying money? Is that reliable, or
Yes.
should I not be?
No, that's very reliable. Even though you don't see it on their marketing, marketing is kind of like, they have it's prime real estate. It's right there front and center on their label. That's the easiest way. But if they haven't been able to afford that yet, that you can dig a little deeper. And yes, that is a reliable way to find out, like you do.
Okay.
One quick way to find out if they're meeting all these standards is to ask them about their third-party lab.
I was just going to ask you that. Okay.
Do you have a third-party lab? Yes, we do. Okay. What are you proud of? What sets you guys apart? What does your third-party lab test for? What's the process there? Oh, let me send you a link to this lab. If the customer service representative doesn't know how to answer that because they haven't been trained yet, I mean, there is somebody there you can talk to or email, and they can they'll be all over. I mean, the lab manager, lab director, they can they'll give you a long-winded email on everything they do because they're very proud of their work.
Right.
So if you're not satisfied with your answers, if you're the practitioner, you just established a wholesale account with the company, you're asking them these questions and you're not satisfied with your answers, ask to be transferred to the lab manager or the senior scientist, chief scientist. Ask if there's any way that you can contact, like what's the email of the lab manager, what's his extension or her extension. If there's a way for you to get in touch with that person, they can actually, because that's their world every day. Right. They can give you all those answers and they can cross the T's. Even if you don't see on a systemic formulas product that it says gluten-free or glyphosate-free or free of peanuts, no nut allergies, you know, any of that, the lab person could actually confirm that and actually give you all kinds of insight to where you're like, wow, that's exciting. I had no idea.
Yeah. And I think that's also another good point is for these gluten-free or glyphosate-free or whatever it may be, a lot of these pharmaceutical grade manufacturers or practitioner grade do have their own farms. They are controlling everything. Whereas maybe some of the less expensive ones aren't growing all of their stuff, right? So they have less control over exactly what's going into it. Is that correct?
That's correct.
Just
no, it's an economical thing. Yeah, if you have that much more working capital and you have a farm or farms or around the world, if you have different aloe farms, you know, around the world where you grow your aloe plants, and you know, I mean, not every company has that luxury because they're small. Right. But when you're buying from a smaller company, you can find out where they source their ingredients. Where is it sourced? And you'll understand the integrity of that company. Right. If Dr. Shane Morris sought out the best collagen possible, I mean, he could have gotten collagen from wherever, but to establish their diverse collagen product, he found the benefits of this supplier in Germany and the benefits of another supplier in Brazil of these grass-fed finished cattle or bovine where they were obtaining these collagen from. If you dig a little deeper and you can find out from the one who answers the tough product questions or from person in the lab or from a chief of operations or somehow if you can dig just a little deeper. I mean, it'd be great if they had all this on their website, but not all companies have gone that far, unfortunately, with their marketing. That stuff that gives them just these huge bragging rights and you don't know it exists because it's not on their website.
Right.
But you might have to dig a little deeper.
Now, I don't know if this exists in the supplement and nutraceutical world, right? But say, for example, like essential oils, they should have a lab report if they're good. Does something like that exist for, where they're sourcing products from in the supplement world?
Yes. Yeah. So number one, what did you say? Young Living Essentials?
I didn't say any particular one, but yeah, I know there's some that haven't, like they don't update their lab reports for 10 years, right? That leads me to think that's a little sketchy, like you threw it up there one time and then it's gone. So
the third party lab will establish what's called a technical data sheet,
okay,
a TDS or C of A, basically the same thing. Unless I'm missing something, but a certificate of analysis, C of A. If you want to ask for the C of A from the company, if you're really wanting to use this particular product that's going to help you establish your goal, but then you just want the peace of mind, you're going to get the actual current certificate of analysis, the most recent one. Somebody in the lab or somebody in the company should be able to send you a PDF with the C of A.
Okay.
And in that C of A, it will show that this ingredient in the product was, or the product overall. So when the product was finished and they tested the capsules or the powder that went into the capsules, they found that it was less than so many parts per million, ppm. Less than, so you got the little less than sign. It will say ppm and this many ppms of lead, cadmium, mercury, E. coli. There are heavy metal, bacterial, fungal, etc., pathogens or contaminants that they test for in the lab. And then you have that reassurance that this whole product you're taking, or you're giving this child, or you're giving this patient or client of yours, is good, and it's free from lead, and it's free from these contaminants.
Right.
So the TDS or the C of A is providing that rest assurance. And it's third party, it's unbiased. It should come from another lab that is not owned by the company you're buying the product for. The company that's going to promote, sell, and market the product, you want it to come from a third party, unbiased lab.
Are there a lot of these labs across the country or the world? Right.
Well, yeah, there's a lot of labs. I think that there's a lot of labs that companies like to, it gives them some bragging rights. But some labs are, and I think that's meant for another discussion in terms of the standard of lab. If you were to go into,
it's like diamonds, right? You got the GIA versus all the other.
Good analogy for it. Really, it's, you could go into Nutribiome's lab and be blown away by, just one machine cost more than a Ferrari. And another machine costs more than a Ferrari. And you've got, Dr. Shane Morris, a biochemist, invested from his own money or his own financing and other things to build this Nutribiome lab. It's not owned by this other company that they do testing for. It's owned by an independent party. That always helps, because then it's that increases the trustworthiness, because there's no bias.
Right. So before we hop off here, let me pick your brain about the whole Amazon thing, because I know that's a big topic in the world. I know other companies, not necessarily in the world we're talking about, they try and limit what makes it to Amazon, right? You can't always stop someone from buying supply and throwing it up there and selling it. But there is also the concern that a lot of things that a client may be buying on Amazon are not authentic, that they are fabricated or whatever it may be. So, do you have any thoughts about that whole thing? Anything at all? Like, if a company, and I know Systemic's not, but if Systemic Formulas had an Amazon store, can you assume that's safe versus, okay, so as long as there's like a store on there, then that's coming directly from the manufacturer. So you generally should be okay with those.
I actually spoke with the president of Metabolic Maintenance Products. They have another brand called Methyl Pro. They're based out of Oregon. And the president told me that their products, their Amazon store has to sell this. They have one main seller or distributor that sells everything through their Amazon store, Metabolic Maintenance. And the price is actually greater on Amazon than the practitioners are able to sell products for independently in their clinics. The online competition has been frustrating for a lot of small and large practitioners. And that's their livelihood. And then you get this independent party who's selling at this deep discount. Yeah, they're not getting as much of a margin, but they're able to sell at a higher volume. And then it's not fair, because the patient goes and exhausts this time being consulted by this professional goes through all this effort, and then the patient knows the protocol, and then they go find it on Amazon, buy it for cheaper. But now they don't have the guidance with supplements. So Yeah, there is that online competition that companies are trying to fight for. But as far as if as far as this particular brand, metabolic maintenance,
Mm-hmm.
that's none of those products are fabricated or counterfeit or they're
Okay.
none of them are actually not legitimate products. I mean, everything is good. It came from their
Mm-hmm.
facility,
Mm-hmm.
but practitioners have the rest assurance that the prices are even higher there.
Can I put you on the hot seat one more time? And it's okay if you don't want to answer this. There are companies that produce supplements in bulk and, give you a bag of stuff. I have some sitting here. What are your thoughts on some of those? Just in general, do they tend to be poorer quality? Because I know some researchers that use some of these products. They are a lot less expensive. So any thoughts you have?
Yeah, they're going to vary from manufacturer to manufacturer. It's going to be far more affordable in some cases if you want to buy a creatine for muscle building or for different reasons, or if you want to get an elderly person who has sarcopenia or muscle atrophy, you want to get them some creatine to help with that. That's going to be a lot more affordable in a bulk of powder in this bag, but it's not going to taste very good.
Mm-hmm.
You could get, there's all kinds of ingredients where it is more economical for sure when you buy in bulk like that, just single ingredients. But again, you've got to dig deeper with that company. Who is that manufacturer? If you look them up, if you're able to get a hold of customer service through online chat or call them, try to find out somebody in the lab. If they have a third-party lab, do they have a C of A?
Mm-hmm.
If they have a C of A, if they are current good manufacturing practices, if they have some these things for you that we've talked about, well, then you're good. Because if they don't have those things in place, then you don't have that rest assurance that this creatine powder,
There's even creatine.
whether or not it's, yeah, what is it creatine? Well, let's say, okay, let's say it's creatine, but does it have heavy metals that are off the charts? Does it have E. coli?
Right. Is it going to make you sicker than,
Mm-hmm. Yeah, exactly. So the
I
bulk supplements are, I think, in some ways effective in that case, but go through the same process.
Okay.
Find out good manufacturing practices. Find out if they have a third-party lab. See if you can get a C of A from that bulk ingredient. Do they have it? Oh, no, we don't. They don't have it. It's like, oh, okay, big red flags going up.
And I think this is, what we discussed today, I think is very important for the practitioners to understand, and even some of the clients who may see this video, that the two are, there's different levels and qualities of supplements. And sometimes if you're stalled or if your client is stalled in progress, where are they sourcing some stuff from that may be hindering that? And it's also part of what sets a practitioner apart, because if it's something someone can get down the street at no cost, there's no value for you. You are customizing a protocol for your client, and with that comes really high quality things. I'm going to see, I tend to source when I spend money for better things than lesser quality things if I want them to hold up and do different things. And what we put into our body is no different. So is there anything, I think this is great. So you talked about the third party testing, C of A's, the GCMPs. These are all really important things for people to look at, and including soy, gluten, non-GMO, organic labels, whatever it is. But do your due diligence. Go look and research things yourself so that you know what you're looking for, and you can, promote yourself more effectively to your patients and clients. Anything you want to add, Mike? I'm sorry, I just went off on a tangent there.
Just one last piece. You're not going to see, like, at the bottom of the label, there's no FDA approval. these statements have not been evaluated by the FDA, or this, product has not been evaluated by the FDA. That just means if the FDA has audited them, they are still FDA compliant.
Mm-hmm.
And if they meet all these other really good criteria and they're good quality, because it's a supplement, it's a dietary supplement or nutraceutical, herbal remedy, etc. If it's going to have to say it's not been evaluated or not approved by the FDA, that's not a problem. What that means is just that there hasn't been that pharmaceutical clinical research, like pharmaceutical devices or pharmaceutical drugs undergo, where you recruit subjects to a study,
Right.
and then you chart, you keep track of their chart and their history and see what side effects they have or don't have, and you pay them. The nutraceutical industry, although it's gotten larger, doesn't have that capital or funds like the pharmaceutical industry, pharmaceutical companies have, to fund a clinical research study, where then you can make claims. This product will eliminate prostate cancer within this amount of time, whatever. It's so in other words, supplements, they do have, although it's not FDA approved, they do have a lot of strict standards that they have to go by. So supplement companies can be extremely credible,
Right.
even though they're not FDA approved. They're FDA compliant, and they have strict rules to abide by.
So even the fact that it says, that it's not FDA approved or evaluated or whatever, that's actually a good thing, because it means that they are on the FDA's radar. They're auditing them, perchance, whereas one that may not have that on there may not even have that extra level. So it's not is that what you're saying?
Yeah, it hasn't become a concern for them yet.
Okay.
Yeah, they haven't been on the FDA's radar. Right.
And
yeah, exactly.
You had mentioned when the FDA came into systemic that they even looked at marketing, and that's an important piece, because the FDA really regulates what message you're putting out there, that you can't make any claims, you can't do things. And even as a practitioner, you have to be very careful about what you say a product can and can't do. We know what things can do, we know how they can support their body, but you want to be careful in not making any claims. So if you need guidance on that, always look at the manufacturer's marketing material. That's a good place to go to keep your, what you say in your message clear.
I think in private communications like this podcast and Facebook groups, YouTube to an extent, there are claims that can be made where there is that freedom of speech, so that practitioners can learn, hey, what's a protocol for hypothyroid? Whereas on the website of the company, if you're just surfing the internet and you see their website for the first time, you're on the homepage and you type in hypothyroidism and nothing comes up. The reason is because they have to abide by the strict compliance with the FDA, where they cannot classify it as a drug.
Right.
They can't classify it as, right. If you do make a claim that these products help with hypothyroidism, you are classifying them as a drug.
Okay. That's good. That's good to know. So I appreciate that. As always, Mike, I love it. I love the tidbits and the knowledge and the expertise you bring to those of us in the industry. We can learn so much from you. We'll keep having these talks and conversations and just trying to up-level everyone's practice. As always, if you're interested in working with Mike or growing your practice, reach out. His Practice Builders University is an amazing place to go to really put yourself out there in this crazy world that we live in nowadays. So thanks.